Good morning. We're here with Nerdy Girls on Dear Pandemic, and we're doing a live chat today with Dr. Valerie Paz Soldan, and I will let Valerie introduce herself.
Hi, Alison. I'm Valerie Paz Soldan. I've got a PhD in public health. I'm a Peruvian-American social scientist, and I'm a professor for Tulane University, an associate professor at Tulane University, but direct the Tulane Health Office for Latin America. So I'm based in Lima permanently. And I'm going to repeat this in Spanish for your Spanish viewers. Me llamo Valerie Paz Soldan. Tengo mi doctorado en salud pública. Soy profesora asociada de la Universidad de Tulane en Estados Unidos, pero también vivo acá en el Perú, donde soy la directora de la Oficina de Salud de Latinoamérica. Y entonces estoy basada permanentemente en Lima.
Thank you. So Valerie, you and I have worked together for 10 years on other infectious diseases, not on COVID, but on Chagas disease, on rabies. You've worked on dengue, malaria, many other infectious diseases. What has the experience of COVID been like in Peru? Tell us about the epidemiology of your outbreak.
Well, the first diagnosed case was on March 6th here. First diagnosed, and I say this very carefully because I suspect that it was really here much earlier, and that's what's affected the peak in the transmission.
Okay.
By March 11th, the government took very fast, decisive action. By March 11th, schools were closed down all across the nation.
Wow, really
and
fast.
By March 15th, we had a complete lockdown and martial law. I mean, at nighttime, military, like there was no one was allowed on the streets past certain times. During the daytime, some people who had passes were allowed on the streets, but it was very hard to get those passes. And for the most part, the only reason you should be out on the street was one member of the family to do some shopping, and it was usually by foot. So it was a very severe, drastic response with the idea that this would like hold back the spread. For 2 weeks they did this. Well, for 2 weeks they did this, and the transmission was still going up, and so they kept it for another 2 weeks, and then for another 2 weeks, and so we had one of the longest lockdowns. I mean, I think we spent about 3.5 months in this very severe lockdown, but it just kept growing. The numbers kept growing, and what has happened in Peru is like what's happening in the United States, where you have these hotspots of spread. And this is where I go back to where I think where transmission was going on before we actually had diagnosed it. And as a result, by the time lockdown came, it was probably already too late. Okay. But for example, early on, one of the hardest hit areas was up in Iquitos, where I do a lot of my dengue work. So I was in constant communication with my colleagues there, and it went through like fire. I mean, so unfortunately, what happened in Iquitos is that by the time, and Iquitos, sorry, for those of you who don't know, it's in the rainforest of Peru, and it's a landlocked, well, it's not landlocked, it's river locked. There's no way to reach it except by airplane or by boat. There's no way to go there by car. And it's got about 500,000 people living there. It's got 3 hospitals that have been underfunded for many years. And so what happened is, when everything went in shutdown, even like doctors who were stuck in Lima, who needed to be in Iquitos, they were stuck in Lima. And because I was trying to coordinate a donation of masks to Iquitos that had been donated by some business person, suddenly my colleagues there are like, can you try to get these 10 doctors onto the airplane, because we need them here? And I'm thinking, how am I as a private citizen supposed to be getting like doctors that are part of the system there? But there was a lot of coordination, and they finally got there. But the bottom line is that it flew through Iquitos. They didn't have PPE, they didn't have all their health personnel there. They didn't have the diagnostics, and there was no regular flights back and forth from Lima. So it was really hard to get them the supplies that they needed. There was a problem here in the 2 or 3 Ministry of Health ago, where the Minister of Health, we have a lot of turnover there, but where the Minister of Health had negated that any oxygen for hospital use that was under a certain quality of like 98% could be used at the hospital level. So all of the companies that had been producing oxygen at 93, 94, 95% quality, like went under, or they stopped their business. and they only kept it for, for plants that would produce high level, but those were like a monopoly of one or two. So a lot of the plants got stopped. And so when hospitals needed oxygen, they didn't have functioning plants at them. So one of the few things that really we know works to take care of patients who are ill is oxygen, and there was no oxygen. So there's been a lot of private citizen efforts to try to help out, GoFundMes to get materials here. A priest in Iquitos who managed to get funds to open up like a oxygen plant so that people weren't paying $2,000 for a tank of oxygen. So in summary, I guess, it has continued to rise. Peru is, in terms of numbers, we've got over 300,000 cases. We've had over 11,000 deaths.
Yeah, I'm looking at your epi curve right now. It's actually the fifth highest by country. You have the fifth most cases in the world after US, Brazil, India, and Russia. I'm surprised to see Peru at number 5.
Me too. And, there will be some that argue that like, well, maybe we're closer to the real numbers. We know that everywhere there's an underreporting, that everywhere the numbers are not quite right, but still we're pretty high up there, even if the numbers are not exactly. We do know that there's also underreporting here. We think that, in Iquitos at least, that there's probably about 5 times more deaths than what was ever reported. And we won't know it till later on. But, getting back to the epidemiology, Peru shut down schools. They went onto TV and radio. So public schools are all on TV and radio. So if you're in the middle of the Andes, you can get your radio out and hear your classes by radio.
Is it from your school, or is it like one central, like here's second grade? Oh, wow.
Yeah, okay. Wow. Yeah. And it's amazing the efforts that parents go through to make sure that their kids like go to their sessions. There have been some amazing teachers who kind of go, from student's house to student's house. Because the truth is that there's been some places where there hasn't been a lot of COVID. Right. But then again, when you have a teacher moving around, that's a problem. So the economy, they created some funds for the lowest income people, which has been done in some places. The problem is here in Peru, the lowest, the economy is extremely informal. So most of the poorest people don't have a bank account. So to go get your funds, you have to go to a bank and you have to stand in line. And so even if you're standing 6 feet away from each other, possibilities for contagion. Then they did some food distribution. Great, nice, except that they try to do the food distribution through the municipalities, which be like your city districts. But the city districts are not usually distributing food, whereas in Peru for centuries, since the Inca times, there's been this habit of what we call ollas populares or comedores populares, where a lot of people come together, especially in times of need, and they make one big pot, and everybody puts what they can, and everybody gets what there is. And so in most communities, you have these communal dining places where the people who are lowest income, the government gives out like big bags of rice and beans and lentils to these places. And there is a group of women usually who cook for free, and in exchange for cooking for free, they get to take food for their family for the rest of the day. And people come and pay 50 cents of a US dollar and take their plate of beans for lunch. So this has been well organized for years. And, from my perspective, more from a sociological, anthropological perspective, you think, why didn't we take advantage of this venue that's so well organized, where it's already been set up to distribute food instead of like trying to change the dynamic of food distribution. So there was economic, there was school issues, health centers. I was in a presentation yesterday about Costa Rica, and I was hearing how the speaker was talking about in their system, people with chronic diseases had pharmacies, medicines delivered to their houses. That's happening in South Africa too, which is under very strict lockdown. So for HIV meds and hypertension and diabetes meds. Yeah. Right. Because people are afraid to go into the clinic. And they should. Yeah. Right. These are high risk people. Right. Yeah. So I had an experience here in Peru where I had to get a medication that you could only get at an oncological center. And they told me, you have to have an appointment to go to the pharmacy. But I told them, like, you want me to come at 8:15 and you're going to take my fever. Like, I might be pre-symptomatic, and you've got people going into the center to get chemotherapy. Like, this is extremely risky for your patients. Yeah. Like, you guys, just during this time, should be finding a delivery way. You should be getting your orders called in or written in or with WhatsApp. There's so many different ways to do it nowadays. And you should be distributing your medications to patients who are not in a clinical center, to keep your real patients safe and to keep those who are still somewhat vulnerable safe, right? So I think that there's a lot of things that we can learn from each other if we heard about the different experiences,
It's a really good point. Like, where's the innovation happening, and how do we get those? Like, how do you now maybe make that happen in Peru, having heard about it in
well, there's been a lot of sharing of, medications or treatments, which,
yes,
as you know, a lot of what has come out so far, nothing is based on a randomized controlled trial, which is the only thing that would really tell us if something is working compared to not. But I think that these other innovations regarding school, regarding economy, regarding migrants. I mean, in South America, we've had a lot of Venezuelan migrants. I don't know if it's 1 million or 2 million. With all these shutdowns, people who live on a day-to-day income by selling, candy on the street or juggling balls. I mean, they don't have cars to entertain and sell things to, and all of a sudden they're left without an income. Yeah. So during the lockdown, it was so sudden that some Peruvians who were here for a particular job were left without a job. They couldn't afford the rent. And then they were either stay on the street, sometimes with kids.
You mean here? You mean home. In Lima?
Peru, in Lima. Sorry, yeah, in Lima.
I never had to go.
So what happened is they got stuck in Lima with no place to be. It's easy to say, well, they could have. I don't know what they could have done.
Yeah.
So what happened is about 170,000 people migrated by foot from Lima to different parts of the country, including over the Andes back to the rainforest, where some of them had their homes and where they knew they would have their social network, their family home, a small orchard where they would have enough to eat and where they would be taken care of. And so, so it's easy to criticize that, yes, they could have been transmitting COVID, like all these migrants moving all over the place. You could also just say, we could have helped them, put them on buses, ensure that they're quarantined for 2 weeks before letting them out, and then let them go, right. but so I think that there's mechanisms that were not tried and it's easy to look back in hindsight and say,
sure.
It's 8 weeks into quarantine and lockdown, when it was clear that things weren't completely working, you do want to look and say, how did we force this one size fits all that may work for a middle class Lima, but doesn't work for a indigenous tribe, indigenous group in the middle of the rainforest? Like, how do we, right. You can't just, Peru is so heterogeneous. We've got such different populations and such different settings and such different circumstances that trying to do one thing for all might not be, and I think, and I think that's something that every country should consider.
Yeah, I think we're trying to learn that in the U.S. I've heard that said about contact tracers, and everyone thought contact tracing was going to be like the new job that everybody could get. But a New Yorker shouldn't be doing contact tracing in rural Louisiana. It's just
right.
It's not going to work.
Yes, exactly. And then there's also the pushback from people who don't want to be, feel they're being observed and put on the spot.
Talk about innovation. We need a lot of innovation.
Totally. We've had less issues with that than what I see happening in the States. The whole, people are told to wear masks and it's mandatory, and people wear masks and they do. And there's no complaints about it. I mean, I'm not sure what the difference is, because ultimately it's a communal good. I mean, we are all protected. It's a little piece of cloth on your face. It's not like you're being asked to, wear a spacesuit every time you walk out the house.
I'm with you, Valerie.
So
if you're out and about, and I know you're not out and about much, but everyone's pretty much masked.
Masked, absolutely.
Wow.
Actually, about 3 weeks ago, they reduced they said you could leave to take a walk around your neighborhood. That was the first time I'd stepped out of my house in 3 months. like on the sidewalk. That, it's been that strict.
Wow.
And then as of this past Monday, we are now allowed during the daytime they're beginning to reopen the economy by phases. And so certain sectors, so they're beginning to let like the buses run so people can get to their jobs, but they're trying to be careful. Like the price of the bus rides has gone up, but they have to keep the buses half empty, for example, right? So they have half the riders that they normally did. So they're opening up. And so as a result, the streets have opened up. I'm still being very careful. What I tell my friends and what I'm trying to tell the public here in Peru is, if you were afraid in March, there was much less transmission going on in March than there is now. Now we're all sick and tired of being indoors. We're all really wanting to go outside. This is living with us for too long. But if you were afraid in March, you should still be afraid now, because we still have transmission. We have a lot more transmission than what was going on in March. So don't relax, and one of the messages that I've been trying to give to people is, if you are going to relax just a tad, do the social circles, the social bubbles, add one more family to your repertoire, add two more families, and communicate about the level of risk, so that, like, yes, your kids can start seeing another child, playing with another child. Yes, it's what they need, but at the same time, you're not just, going crazy and letting it all out. So
that's good advice. We should wrap up soon, but Valerie, tell me a little bit about how your research has been impacted, and are you working on different stuff? Have you COVIDized your research agenda? It's
hard not to. It's as a scientist, it's sad to say this, but it is an exciting time to be thinking all the different research questions. Most of my research is very field-based, as you know, since you've worked with us in Arequipa. So we do a lot of community-based, field-based work. And so we are having to rethink a lot of our work. But in many ways, it's kind of exciting, Alison, because if you think about it, there's so many different technologies and innovations that we could be using nowadays. Right. And in many ways, this experience has forced us to say, okay, instead of doing this field-based with people going door to door, or with people doing this, how do we make this more virtual? For example, for our project with Chagas, can we start thinking about like checking people's houses like virtually, where they walk us through their house and we tell them, where can you look for triatomines that might spread this, and show us under here and put a picture on your wall. I mean, can we make the denuncias, how do you call denuncias? The reports of a bug sighting virtual. So instead of bringing them into a bag to a health center, can you take a picture and send it to our team, and we can tell you if this is a dangerous bug or not. So I think that that's
our next grant, Valerie, right there.
Yes, there we go. But and then the same thing with cervical cancer, in Iquitos. We were moving to an HPV-based system instead of pap smears and visual inspection. And we're moving towards a more primary level system. Mm-hmm. And what you see is Peru's health reality is most of the places are primary level. I mean, we don't have enough hospitals. Outside of Lima, we don't have enough hospitals for the most of the population. So what are the strategies that we should be thinking about long-term that move healthcare and strengthen the primary health system so that they're level? So with HPV testing, for example, women can self-swab. And so you don't have to go into a doctor's office. You can take your own swab, you can put it into a little container, and somebody can test it for you. And if you're positive, then you can be managed in a clinic setting, but you don't need to necessarily be in the office with a midwife, who is normally the ones who do it. So how do we change systems? And I think what this gives us an opportunity for, and I think this will happen everywhere, Alison, South Africa, United States, Peru, is, I think especially, in a lot of places, our health systems are built like, okay, now we have use of this. And so you kind of Frankenstein it. You put it all together because you already have a structure, and now you add this, and now you add that, and now you add this. And I think this is an opportunity for us who have recognized for decades certain limitations in the health system, and to start from scratch in many ways, to say, okay, when we built these systems 100 years ago, we didn't have all these different innovations and technologies, but now we do. So let's think of our ideal health system. And instead of just adding a new piece, like let's add that virtual piece, let's add that, what's up component. Why don't we go down to the basics and say, what would be our ideal system like if we designed it right now? And I think in the States there are other questions, for example, about, universal healthcare. I mean, why in the middle of a pandemic are people uninsured, losing jobs, but again, it really allows you to say, let's take some time right now to think about the system that we have and strengthen and start with the innovations that exist in the world this day, because they didn't exist 100 years ago, and we should take advantage of this opportunity.
Don't let a good crisis go to waste.
I mean, and I mean, again, it's as a scientist, my work, yes, I continue working with dengue and with Chagas and cervical cancer and rabies, but a lot of our projects, it's kind of like, okay, well, since we've been doing contact tracing for dengue, like how would we change that to do it for COVID? And since we've been doing, this work with looking for bugs, how do we add looking for fevers? And, it just gives you ideas for innovative ways to tackle questions related to COVID that are field-based and not, we're not clinicians, so we're not looking for the latest vaccine or treatment. We're looking for ways to do more of the surveillance at the population level.
Public health stuff.
Yep.
Valerie, thank you so much for spending this time with us. I hope everyone stays safe and stays well in Lima. I'll want to check in again as the country opens up a little bit. And I think we should write that grant on on virtual checking. Thanks so much. Take care.